Hello, my name is Julia. I'm a birth doula, and today I'm going to dive into simple yet powerful ways in which you can support your partner while she's in labor. First thing that I want to share is that sometimes doing nothing is doing something. I know that it's baffling to understand, especially when you're seeing someone who might be struggling or maybe in pain, going through a really intense contraction. But honestly, there is not much that you should do, have to do. A lot of times it's just being there, which is challenging in itself. But I promise that sometimes just showing up, just being there is a lot of the support that women need in labor. What I like to share with a lot of my clients' partners is be present, not perfect. Crazy, I know. You are not a superhero. You do not have to come in and solve every problem and fix everything. Birth is really unpredictable. So, a lot of times, just being that steady constant is the support that a lot of women need. Just remember to breathe with them, stay calm, and that your presence alone is comfort enough. Now that we are done with all of that woo woo lovey dovey stuff, what are tangible things that you can actually do in labor? Physical touch is one of them. Now, some women love physical touch during labor, some can't stand it. So give it a try. Sometimes just gentle, light touch massage, maybe some gentle circles up and down the back, up and down her arms, lower some light pressure on her lower back. A hip squeeze is really helpful. Other physical things that you can do is just placing a cool washcloth on her forehead or right behind her neck, offering her water, snacks, food, things like these to just help ground and center her. Next thing is to take care of yourself so that you can take care of her. This is often overlooked for partners in labor. A lot of times you are so focused on making sure that they are eating, that they are drinking, that they are changing positions, that you don't take care of yourself. I have seen partners faint. I have seen them get woozy. I have seen a whole bunch of things, but make sure that you are staying hydrated. You're having electrolytes. Maybe sometimes, especially if you have another support person there, whether it be a doula or her mom, anything like that, maybe take a step outside, touch some grass, get some sun so that you can really feel like you can be the best support for her as well. Labor often takes hours, if not days. It goes through ebbs and flows. There are times of rest, there are times of a lot of activity. Your partner might not need a massage or words or a hip squeeze, but what they do need is space to be in their body, zone in, and really focus on what it is that their body needs. If they are constantly being distracted, and something as simple as a hip squeeze or you asking them, "How are you doing? Rate this on a scale of 1 to 10." Like that pulls them out of their birthing bodies when they really need to zone in and focus on themselves. Labor isn't something that you can fix, and that is perfectly okay. Sometimes you just need to be there with your loving, calm, and patient presence. Maybe you're getting to the end of this video and thinking, she gave me nothing. And that's okay. Everyone is different, but know that your presence alone is helpful and being that emotional support. Some other things that I would suggest as you're preparing to be a birth partner is to educate yourself, whether that's reading about birth, watching videos of what birth actually looks like, so that you know exactly how she might respond depending on what stage of labor she's at. How can you be the best support in early labor? What does it look like for transition? And what emotional state is she going to be in? So, again, every birth is unique. Yours is no different. So, make sure that you get the tools, the resources, and the people surrounding you to have a positive birth experience. Bye.